The United States is standing on the edge of a major political crisis. A potential federal government shutdown is only days away. At the heart of this conflict is the question of healthcare subsidies under the Affordable Care Act. During the pandemic, special subsidies were introduced to make health insurance premiums more affordable for millions of Americans. Now, those subsidies are set to expire. If Congress does not act, millions could see their premiums skyrocket. At the same time, the deadline for passing a new federal budget is approaching. If no agreement is reached, the government could shut down, affecting millions of lives. House Speaker Mike Johnson argues that the government must remain open, but insists on a clean, continuing resolution, a temporary budget that funds existing programs without adding Democratic demands for healthcare subsidies. Johnson has accused Democrats of using the threat of a shutdown as a political weapon, pushing their agenda while ignoring the urgency of keeping government services running. On the other side, Pennsylvania Governor Josh Shapiro takes a different stance. While Johnson focuses on budget mechanics, Shapiro emphasizes the moral and social dimensions of leadership. He has criticized selective outrage in American politics, pointing out that leaders often condemn political violence only when it suits their narrative. According to Shapiro, true moral clarity means denouncing all violence, regardless of political origin, and ensuring that policies like healthcare subsidies protect ordinary families rather than fueling division. For ordinary Americans, the stakes are enormous. If subsidies disappear, middle and low-income families could see premiums rise dramatically, pushing healthcare out of reach. Hospitals and clinics may face greater strain as uninsured numbers grow. And if a shutdown occurs, federal employees may go unpaid, national parks could close, and essential services like Social Security offices and FEMA disaster response could face delays. The political fight is heating up. Johnson has made it clear that Republicans will not tie healthcare subsidies to the short-term spending bill. Democrats, including Senate Majority Leader Chuck Schumer and House Minority Leader Hakeem Jeffries, argue that they cannot support any resolution that fails to protect health insurance access for millions. Both sides face pressure. Republicans want to show fiscal restraint, while Democrats insist that protecting health care is non-negotiable. The American public is equally divided. Some prioritize avoiding a shutdown at any cost, while others believe healthcare security must come first, even if it means political brinkmanship. This conflict is more than a budget dispute. It is a battle over values, whether America prioritizes fiscal conservatism and short-term stability, or long-term commitments to healthcare access and moral leadership. Johnson represents the call for financial discipline and limited government spending, while Shapiro symbolizes a plea for clarity, fairness, and protecting citizens from both political violence and economic harm. The clock is ticking. If no deal is reached soon, millions could face higher health costs, and the nation could enter yet another disruptive shutdown. The outcome will depend not only on political negotiations but also on public pressure, the voices of ordinary Americans demanding solutions. What do you think? Should the government stay open even without extending subsidies, or should subsidies be defended even at the risk of a shutdown? Share your opinion in the comments, like this video if you found it useful, and don't forget to subscribe for updates as this political battle unfolds.